for your goal writing and SOAP note assignment. The first thing you'll need to do is click on this link for the YouTube video. You'll watch that video. Now please note, you are not doing an evaluation on this client for depression. You are, however, writing a SOAP note based on the information that you hear and see, as well as your professional judgment based on that information. So you're going to imagine that you are the OTA who is interviewing this client. You're going to identify a problem, occupation, area, or skill that you see in this video, or that you hear in this video. Now remember to be specific when identifying that skill and only include one. It is acceptable for you to mention the diagnosis. However, the diagnosis does not need to be the concentration of the problem statement. So for example, you would not say that your problem area is depression. However, you may say that your problem area is the client is unable to complete her daily hygiene activities because of her depression. So you can include it, but that doesn't need to be the concentration of it. Then write one long-term goal and two measurable behavioral objectives or short-term goals in COAST format using the fill-in-the-blank sentences that are provided. Then you're going to write a SOAP note based on your observations and your goals, and you're going to use the examples in the documentation lesson as well as the SOAP note rubric to guide that note. Then I'll provide constructive feedback to assist you for future SOAP note assignments. So it is super important when you receive your grade with the feedback for this SOAP note assignment that you review that feedback, because it will be very helpful for you for the other two SOAP notes in this course. So then I want you to know that when you're writing documentation, SOAP notes are used for documenting treatments to file insurance, but also for quality management and improvement. And what that does is it measures how the services that you're provided are excellent, or how they meet the needs of the client. So you want to make sure that those services remain excellent and that you're doing the things that you're supposed to do. So there is a part of the assignment that requires you to look at that and comment on that. So that's why that bullet point is there. You'll want to look at the Advancing the Value and Quality of OT article in your Module 2 reading list in order to really get a good idea of how to answer the question about the quality management and improvement. Then below your signature on the SOAP note, please include a 3 to 5 sentence paragraph describing how a SOAP note can be used for quality management and improvement in a therapy department based on what you've learned from the article that you read and just maybe what you're thinking. Then some helpful information for completing the assignment. The client's being seen by you in a conference room. So hint, hint, that's usually something that's required in a certain section of the note. So make sure you're paying attention to that. And then also the client's been admitted to a psychiatric unit. It's locked and restrictive. So if you're creating a goal for the client to be able to go to the grocery store, that's not an appropriate goal for someone in a locked and restricted unit. Then you have a template here that you'll use to complete this assignment, and you will look at the template and you'll see that, as I said earlier, you've got your fill in the blank for your long-term and short-term goals. You've got your area here for your occupation, area, or skill that you feel is the main problem area. And then you also have your spot to do your SOAP note. So just make sure that you follow those instructions. As always, with all of your assignments, I will speak about this in almost all of these videos. In addition to watching the video and reading the assignment description, I would highly encourage you to review the rubric, because that provides additional information on exactly what we're looking at and how you'll be graded on these assignments. If you have any questions or concerns as you're completing the assignment, please do not hesitate to reach out to your instructor.